This root canal was done by a patient's general dentist a few years back. So patient says tooth feels achy and it hurts right above the tooth. So take a look here. Alright, so that's the MB root. There's definitely something going on. Missed MB2 possibly 90% of the time. But take a look here. The dentist missed the distal buccal altogether. Distal buccal canal altogether. And this tooth, of course, has a permanent buildup and a permanent crown on it, despite the fact that the distal buccal canal was missed and maybe possibly MB2 was missed. So went and restored it permanently instead of referring to endo right away. Now look at this beauty. This patient was referred to me by another endodontist for endodontic retreatment of tooth number 3. The other endodontist said that, according to the patient claims the other endodontist said that he didn't do retreats. So I said, okay. So this root canal was done 3 years ago, according to the patient. You can see a PFM crown, previous root canal. Take a look here. Do I need a CBCT? Nope. Look at that. Look at that missed MB2 right there. And again, periapical lucency. I don't need a CBCT. 2 PAs and done. And of course there was a sinus tract on the buccal of the tooth. So we're gonna redo this root canal. Don't miss the MB2s, don't miss canal. And I guarantee it, if you ask the dentist who did this root canal and the dentist who did the other root canal, the other tooth with the missed DB canal and probably a missed MB2, and this dentist who did this root canal with the missed MB2, they would tell you they have 100% success rate. Their patients never come back. They do root canals and crowns and their patients are perfectly fine and they never come back because they have 0 failures. Well, they don't have, of course, 0 failures. The patients don't go back to them. Usually they go see another dentist or they go see another endodontist. So don't think just because you do lousy root canals and you don't have your patients coming back to you, that means that your root canals were successful. No CBCT, missed MB2 right. This patient was referred to me for endodontic retreatment of tooth number 8. According to the patient, this root canal was done a year ago. The reason for the root canal was trauma. Patient says there was trauma to the tooth. So the dentist did the root canal for him. As you can see, there's a periapical lucency here. Also, take a look. A sinus tract on the palatal. Right there. So tooth was tender to percussion and palpation. Patient said that he felt itchiness inside of the tooth. So whatever that means. So we went ahead and traced that sinus tract, and take a look. It goes to the middle of the tooth, of the root, kind of corresponding to where that post ends. So there is a possibility that there might be vertical root fracture here. Possibility. Probings were 2 to 3 millimeters all around. But the fact that the gutta percha goes to mid-root here kind of worries me. So I talked to a patient about that. And this being the front tooth, patient says, let's try to see if we can save it. So my plan is next time, remove the post, remove the gutta percha, and I'm just going to fill the whole canal with MTA. We'll see what happens. But told the patient, no promise or guarantees. So if the sinus tract doesn't go away within a reasonable amount of time, 2 to 4 weeks, then he would have to pull the tooth. Patient agreed. Yeah.